Hello, everybody. Sorry for the delay in getting started. We had a few tech issues here, but I think we're ready to get going. Are we ready to get going?
We are.
Oh, good. Okay, great. So you are at a patient-oriented research workshop that was co-developed by the BC Support Unit and the Faculty of Medicine here at UBC. So we're very glad to be here today. So let's get started. First of all, we have no conflicts of interest to disclose, and this workshop is based on the Foundations in Patient-Oriented Research, which is the national curriculum developed through CIHR in patient-oriented research to have a standard sort of approach to patient-oriented research across the country. Sorry, I should have introduced ourselves. I'm a little bit flustered because we have problems with the technology here, but so my name is Larry Mraz. I am the Research Navigator and the Patient Engagement Coordinator at the BC Support Unit. And that simply means that I work with researchers to help them find out what services they need around patient-oriented research and patient engagement, and do consultations, and we have lots of resources, et cetera, that I can help you find. And with me, we have Bev Pomeroy.
Yes, I'm Bev Pomeroy, and I'm your quintessential patient partner that you're going to meet along the way. I'm on the provincial board of the BC Support Unit, as well as BC Patient Safety Quality Council, Accreditation Canada, to name a few. My background is in healthcare, but I came to be a part of patient-oriented research when my youngest was born with a rare, complex disease process. And so through my 16 years of navigating the healthcare system with her here in the Vancouver Centre area, it kind of changed my perspective of being a healthcare provider to being a caregiver. So that's my role here, is as the patient partner. Sophia unfortunately passed away 2.5 years ago at the age of 16. So I've just recently popped my head back up to help sort of facilitate this sort of dialogue and really bring sort of the grassroots patient aspect and lens to the conversation. So thank you for having us today.
And when she says she is the quintessential patient partner, she really is. Bev is involved in everything from governance of the BC Support Unit to co-facilitating events such as these. When we do the modules for the national curriculum, Bev is also there for full-day workshops. And so her insight and contributions are invaluable. So thank you for being here too, Bev. So what we're going to do today, we've already had our lunch, hopefully. We're going to go over the objectives today, some definitions about patient-oriented research, the benefits and values of patient-oriented research, how to do this. We'll go into that a little bit. Remember, this is an introductory workshop. This is meant to be just an introduction, a taste of what patient-oriented research is. We can't, of course, teach you how to do it in 1 hour. But we'll talk a little bit about some of the ethical and cultural issues that you think about when you're doing patient-oriented research, because there are when you're looking at different groups of people, different populations. And we'll talk a little bit about applying patient-oriented research to your own work. And this is a workshop. So you do have a worksheet with you. Everyone should have a copy of that. So at certain points during this presentation, we'll be stopping and asking you to reflect and make notes. The notes are for you to take home, just as a way of sort of getting you to think about some of these issues during the workshop while you're here, instead of going off with them and thinking about them afterwards. And then we'll end up with a 5-minute question and answer period at the end. And then after that, we have these evaluation surveys that we'd love for you to fill out. You have to pay for your lunch after all, right? So, all right. So let's start off with the workshop objectives here. So what are we expecting you to learn today? A working definition of patient-oriented research would be great. A little understanding of why it's valuable, why you should be doing it. Some examples of when and how to do it. Some of the cultural and ethical considerations to think about, but again, not in much detail for this workshop. We're going to look at some ways to do it in your own research. And I think that's something I'm really hoping that you walk away from today, is to have a thought of how you might be able to do this in your own work. And recognizing that everyone's at different stages. There's some people here I recognize that are already doing this sort of work. So thank you for being here too. And then finally, we're going to end off with a little bit of a plug for the support unit, sort of explain what we are, why we exist, and what we can help you with. So let's start off with what we mean by the word patient. So this is something that becomes a bit of not problematic, but it's an interesting conversation to have. And when you ask people what we mean by patient, all of these different words come up in this word cloud. And the word patient is loaded. It implies certain things, but we have a patient partner here. So Bev, can you tell me what you think about the word patient?
It definitely is a loaded word. I'm a caregiver, so I don't necessarily fall into that patient realm, although I'm sure I will shortly. But so for a lot of the partners and patient partners you're going to have, it's just really important to understand and ask and just be curious of how they identify. It's probably one of the most important things. But any of these terms are used across Canada, the U.S., and going into the UK, you'll see different versions of patient. But when BC Support Unit says patient, it means this all-encompass. Okay, so when we use that word today, just look at those particular terms and know that's who we're talking about.
Absolutely. The word patient implies a power differential between patient and doctor, for example, so some people don't like that word. But the important thing, the issue that we're trying to get at here is that a patient or a caregiver or any of these other names, it's a person who has lived experience that is necessary to help you move your research forward. The idea that they have some experience with the health system, with an illness or a caregiver role, for example. That insight is what is often lacking from the research process. And so this is the bottom line here for patient is it's someone with personal lived experience. And that's what I always want you to be thinking about. The reason why we're bringing a patient partner into the research process is to give us a different perspective. If we already had that perspective, we wouldn't need it. We're all patients at one time or another. Maybe we all encounter the healthcare system. But what we're thinking about here is what lived experience is going to help you make decisions in your research. And that is the key here. So we have this working definition, research done in partnership. This is the definition of patient-oriented research itself. So research done in partnership with patients, and that is patient engagement is the term we use for that, which is different from other terms around the world. But this is all about answering research questions that are important to patients. What are the research priorities? What are the research outcomes that they're interested in? And overall, the overarching thing, or the underlying thing, is that we aim to improve healthcare. And so that is one of the key features of patient-oriented research. So let's see if we can take a look at this video. Now, how do I get to that? There we go, and then just, oh, it's great. This is just a 1-minute little video.
Are you frustrated like I've been by research that doesn't apply to your clinical practice or your patients? Well, fortunately, there's a better way. We can make research more relevant by getting ourselves and our patients involved in health research in BC. The BC Support Unit helps healthcare providers like us work in partnership with patients and researchers to choose what to research, how to research it, how to interpret the findings in a way that makes sense clinically, and how to shape the findings in a way that it can be easily shared and used. If you'd like to learn more about how you or your patients can be more involved in health research, go to our website, bcsupportunit.ca.
Great. Now, how do we get back to Gabe? Great. Thank you. So one of the things that came out of that video, I think that's important, is this understanding that it's not just the patients that are involved in patient-oriented research. When we conceptualize patient-oriented research, we think of it as a multidisciplinary sort of approach to doing this work. The key point here is that you want to have the knowledge users, the key stakeholders in the research, and that can include, of course, researchers and patients, but also clinicians. And I think when we think about it, when any health intervention is developed, who's going to be delivering that intervention, who's going to be receiving it, and then who's going to be determining the policy about how that intervention is going to be delivered, who's holding the purse strings, for example. So those things are all considered in this. One of the key features of this, of course, is that a patient is involved. Patient voices are involved in the work, that they are patient priorities and outcomes. But we really encourage multidisciplinary teams in this. And also, one of the key underlying features of patient-oriented research is the intention to inform practice. That is, that you are somehow thinking about how your knowledge is going to be translated into practice. And that's where maybe it's very important to have policymakers involved in some aspects of the work. Easier said than done, but that is the goal. So when we think about this, we think patient engagement is a key feature of patient-oriented research. So how does that work and where does it happen? So first of all, the word collaborate is really important here. We're not informing, we're not getting feedback from, we're collaborating with patient partners in these 4 areas: governance, priority setting, conducting research, and knowledge translation. So these are very broad areas, but perhaps a couple of examples might help. Bev, do you want to give us a few examples here?
I think the other word here is meaningfully. So for myself and my lived experience, obviously pediatric palliative care and pediatric complex disease is something that's meaningful to me. So those are the particular things that interest me in women's health. But in these particular areas here, I play a multitude of roles. Just to give you some examples, so governance, I'm on the Canuck Place Children's Hospice on their governance team. I'm also influencing the strategic plan of the Academic Health Sciences Network. Priority setting, again, when you have patient partners involved in your organizations, we are a part of your strategic plans, or we're helping to inform your research. So I do that consistently with BC Support Unit, BC Patient Safety Quality Council. Conducting research, I'm actually a co-researcher. A couple of us, especially on the island, have got associate research status. So we're co-leading research and doing some patient-led research along that way as well. And knowledge translation, that's just starting to kind of move forward. A lot of us right now are using Twitter as a means for knowledge translation and getting it out there to other patients and people in our world. So those are just like snippets of this massive sort of shift in how we're thinking of doing research.
Thank you, Bev. So this is the time where you have to do a little bit of work. I'd like you to take 1 minute and just to write down what you think the definition of patient-oriented research is, or how you conceptualize that. This is an opportunity to synthesize what we've learned in the last few minutes. So I'm really glad to see that everybody has actually taken it upon themselves to actually do a little definition. Does anyone want to share their definition? I promise I won't go through everybody, but I'd just like to see if anyone has an idea that they want to.
And just turn your mic on for the other locations.
Absolutely.
If you have want to share.
Yeah, I don't know how to hear from the other locations. I'm sorry. So we're going to get someone from this room to do it. Anybody? Should I ask someone? Lena, do you want to tell me what your definition of patient research is?
So I think patient-oriented research is
Hang on a second. Okay.
I think for me, patient-oriented research, based on what we've briefly discussed, is involving patients throughout the continuum of the research process, from research design and formulating the question to the actual analysis of data, and making sure that the research that we're engaged in is applicable and it is relevant to the patients, and that the outcome is something that is meaningful for them as well as the clinicians.
Thank you very much. Hate to put you on the spot like that, but no one else is volunteering, so I'll go to that side of the room next. Yeah, this is great. Thank you. That's a very good definition. So when we gave those examples of what Bev was talking about, there's lots of different aspects of patient-oriented research and patient engagement in all aspects of the healthcare. at the support unit, we do focus in on the research aspect, which is a little bit different from some of the other governance or health system policy changes or healthcare services quality improvement, but we do focus in on the research area. So one of the questions that we get a lot is, why are we doing this, and where's the support unit from? And some of you might have heard of SPORE already. If you haven't, it stands for the Strategy for Patient-Oriented Research. And this was a strategy created by CIHR in 2011, and it is all about, of course, improving the healthcare system, but all about building the capacity to do patient-oriented research throughout the country. And through the strategy, there were several support units set up. There were support units in every region and province in Canada, and BC is just one of those. We are a multi-partnered organization. We have more than 40 partners. We are a complex organization, but we partner with universities, health authorities, Ministry of Health, and we have regional offices. So there's offices in Vancouver, Fraser, Island, the Interior in Kelowna, and in Prince George. So we have a mission to do this throughout BC, not just in Vancouver. And it's all about building the capacity to do this work. And one of the ways we do that is by doing awareness. We do education and training. And so, you know, there are certainly lots of options for that through the support unit. So let's go into the benefits of doing patient-oriented research. So we have to think about why. So the strategy of patient-oriented research was not just created just to get patient voices into the work, into the research. It was built on this need to get more evidence into practice. And I think that is the real important thing here, is that it's the moving research knowledge that's been created. Some people refer to the health research in Canada as being kind of pilot studies that don't necessarily make it into practice. And there are some estimates that say that 17 years from the time the research project is completed to the time that any of that knowledge actually gets into practice. And only 14% of it is believed to actually make it. So that means there's a lot of research that's being generated, a lot of really good research that's being generated, but it's not being applied. And one of the reasons why is that it may not be relevant to the knowledge users that you're intending it for. So this is a reason why we need to do this. And especially when you consider that with the costs of healthcare going up, we need to be more efficient with our dollars. So this is a framework that was built just to sort of show you the underlying reasons and rationale for this. The base of this framework is that knowledge users are important to bring into the research process. When you get knowledge users involved, they can bring input into the health research priorities. They can help with the design and the conduct of the research products, of the research itself. And when you do that, when you get knowledge users involved in that, and researchers get to understand what's important to the knowledge users, that is expected to increase and accelerate the decision-making, the translation, and uptake of new practices, which is, of course, what we're trying to do is to bridge that knowledge-to-action gap and to cut back that 17-year gap between knowledge and practice. And, of course, this is going to improve the entire healthcare system. And, Dale, did you want to add something to that as well?
I just think from my perspective, I just think it's as a patient partner, what we're trying to do is collaborate in a way that we can partner with your sort of collective intelligence and our collective experience. And I think, you know, the patient engagement world has shifted a lot in the last number of years. It really is a social change sort of movement. But putting it into research, I think, will have direct implications on how our families are supported. You know, it was too late for my daughter with her rare disease. But you look at the SMA kids that are out there, and the evolution of research that's impacting them is quite amazing. So that's my hope as a patient partner, that we'll actually have a deep impact on families and community in the end.
And so you'd be positioned there as the basis of this, in this framework too, as a knowledge user. And that's kind of one of the important things to consider here. Knowledge user getting involved in the entire creation of knowledge.
Well, we're the bedrock of community, right? So I think it's important that it's there.
And of course, there's been a lot of push and pull to do this work from both funding agencies, journals, etc. And speaking of journals, what is the evidence? What's the literature say about patient-oriented research? It's a fairly new thing. It's being done in the UK for the last 20 years, but one of the things that has been lacking is a systematic evaluation of the methods and the processes involved in patient-oriented research. You have to think of this as a different way of doing research. It's not the traditional way. It's a different way of looking at patients. Patients become partners in research instead of just participants. You're not collecting data from them. They are helping you make decisions, and that's a key important point. So how do you measure the effect of that? How do you evaluate that? And there is some evidence out there, and I encourage you to come and look at the support unit website. Our resources page talks a bit about some of this. But there are some great articles there. These are just a few that show some of the demonstrated benefits of doing patient-oriented research and all these things that I've already talked about. But let's look at some of the more specific things that have come out of the literature. Well, we do see that there is an enhanced quality and relevance. The research is more relevant to the knowledge users, at least. That's the bottom line from this. We do find that there are some unexpected side effects about empowering patients when they become involved in research. Certainly it does change their relation to health and to health care they receive. And there are some other important, practical things. One is recruitment is increased in projects that have patients as partners. So the bottom line, if you're struggling with recruitment for your project, see how a patient partner can help you with that. Bev, what's your experience?
Well, I think with some of the research projects I've been a part of, when researchers are looking for other patient partners, they're looking even for subjects in their research. I have a demographic of connections that I can push something out to, and my doing that as patient partner is a little bit less intrusive, I think, sometimes than a researcher. It's less scary for patients. It's less scary for families. Quite often I go in and have conversations peer-to-peer in ICUs in different areas around the province to engage that demographic or whatever the demographic the researcher is looking for. And just anecdotally, the response and the uptake is far greater than just simply sending out a survey, just anonymously cold calling a bunch of patients or patient partners.
Mm-hmm. And you were involved in creating a grant proposal recently too, weren't you?
Yeah, for actually a project here at UBC, you can't mention it, but yeah, for sure. So we're part of that. I do have grant writing experience anyways, but I was named in the grant. I'm one of the co-researchers, so that's another thing that we participate with, and it's been quite successful too.
And that's well received. We see that in grant reviews. Proposals are reviewed if there is a sign that patients are engaged. It's looked upon more favorably. That hasn't been quantified, but we do get that anecdotally from the funding agents. So Michael Smith Foundation, for example, or CIHR, when they're reviewing grant proposals, even though it might not be a criteria for that grant application, they often look for how can this work be advanced? And if there are signs of patient engagement, then there are signs that this could actually improve the uptake of the work. But there are some challenges. It does take longer, costs more. There's always this fear of tokenism, and that's something that you've talked about, Bev, too, a lot, tokenism. Do you want to talk a bit about that, or? Well,
even just going back to the grant idea, if just having a patient partner, if your motivation is to get grant money, that's tokenism, right? And we see it quite often. I've been a part of a lot of different initiatives where I know I'm just kind of the person sitting at the desk or sitting in the boardroom. It does happen a lot, and I think it's a really difficult thing to kind of shift from. I'm hoping you're doing this kind of work that we'll get there. But it's something to really, really consider for sure.
And again, by tokenism, we just mean that patients are invited to take part in the research, but they're not truly engaged.
Right? Ticking a box.
It's about collaborating.
Yeah.
And sometimes it's really difficult to figure out how to do that. And I think that's really kind of an important piece to this, is that when you're sitting there thinking to yourself, how am I going to do this when I've done my research in a particular way all my life or all my career, and now I'm being asked to collaborate with the patient, how do I go about do that? It's not simple, but it's doable, and it just takes time and it takes practice like any other thing, any other process in research. And it's kind of a process instead of a method. It can be applied to all methods. Do you have a question? Sure.
So how does this work for you? When you're participating in these, are you getting a stipend or getting paid for this, or you're expected to do this out of altruism and always out of goodwill? Because I think it's a difficult line to navigate at some point.
Yeah.
You can almost be exploited.
Absolutely.
Because the researchers may or may not be paid, but it's their career. It may not be your career.
Mm-hmm. That's a great question. We are going to get to that further on in the slide, but absolutely, and it's a huge conversation that's occurring right now. So we'll talk about that a little bit later, and I can help you. I can explain that for sure. Thank you for the question.
It is a great question.
It's a big question.
And it's something that the support unit's been working on for the last year and a bit. We have our own patient appreciation policy that deals with compensation and reimbursement. And we can certainly help you with that. All right, so I would like you to get back to your worksheets again and just sort of write down what you think some of the benefits you might get if you did patient-oriented research. And if you're doing it already, what things you might do to improve it. So we'll just take a minute to do that. Again, great to see everybody writing things down. Does anyone want to share with some of the benefits they've come up with? Imaginary or hopeful, or however you want to have them from this side of the room now. Great. Oh, we have a volunteer. Thanks.
I think it would help to improve the salience and applicability of the research and identify the research questions that truly have priority to the people that it's ultimately serving.
Absolutely. That's great. Thank you. Does anyone else want to add anything to that? No, I won't make anyone else talk now. So this is great. One of the things that I think it's really important to think about when you're doing this work is to sort of think about what you want to get out of it. What's the researcher's expectations of this? And that will actually help you to think about what sort of benefits you might expect to have. All right, let's go into now a little bit more in depth about doing the actual engagement and some of the ethical and cultural considerations. So this particular diagram here looks kind of daunting at first, but all it is a framework that someone did from their own research project, and this is published in a journal article, and it outlines their research cycle from left to right, from the clinical problem to the changes in practice. That has how they conceptualize their research cycle or their research process. So anyone who does research can come up with their own sort of cycle of research, and it would probably be somewhat similar to this, might have some differences, but the ultimate bits are going to be the same. There's going to be things like securing funding and conducting the research, getting ethics. I'm jumping around here, but you see what I'm getting at here. This is just a standard research cycle. Above, on the top, we have all the work that the researchers do in that. So let's just pick one of them. If we look at ethical approval, it's gain ethical approval for study. So they have to fill out the ethics forms, the RISE, whatever it is at UBC, for example. But how do you get a patient partner engaged in that? Well, maybe they can review some of your documents you need, like your consent documents. So I don't know if anyone here has used consent documents before where they've been multi-pages and very complicated, and patient participants in your study look at them and they don't know what it's all about. I certainly, when I did my own health research years ago, I found it difficult to recruit because of the consent forms. So if you have a patient partner that can help you make sense out of some of these things, help you explain your research to other patients, that's a huge benefit. So down below in the boxes, we have all the places, and it's called PPI here, public or patient involvement. But that's just the term they use in the UK. Here in Canada, we call it patient engagement. In the UK, they call it involvement. In the US, it's patient-centered. There's lots of different terms for it, but we're sticking with the idea that we're collaborating in decision-making in the research process. So this just gives you an example, all sorts of different places where you could actually do this work.
And just so you know, to your patient partners, like when I first started this, I had no idea what a research cycle was. So having some references and kind of using something like this as a tool is really important along the way.
Okay, great. So like I said, don't be daunted by this. This is just an example. There's lots of different ways that you can conceptualize this and lots of different opportunities for engaging patient partners in your work. There's no one particular way to do it. And for a lot of people, the easiest way to do this is to engage patients when they're doing their knowledge translation at the end. But if the knowledge you created wasn't relevant to them in the first place, then even that won't work as well as it could. All right, so we do have some things that you need to consider to do this work. Engage as early as possible. So when Bev talked about tokenism before, we see this all the time. We'll see someone submit a proposal to the support unit for a letter of support or for some help with their patient engagement plan that they're going to submit soon, like maybe tomorrow, and they ask for help. And maybe, can we get a patient partner to read it for them? You know, that's not going to fly.
And then I get a frantic text from Larry.
Not too many,
Not too
hopefully.
many.
But it really is an important thing that when you think about this, that you really want to think about, if you're going to think about research questions that matter to your patient partners, you have to start talking to your patient partners really early in the process. And I can't stress that enough. That is really important to do. However, having said that, if you're beginning this and you don't know where to start, and it's kind of daunting, how do you create a research question? You have to write grants. You have to find out what the funding opportunities are. So you have a program of research. So it's finding an entry point for your patient partner into it. Don't be thrown off by the thought that you have to get someone right at that stage. The earlier upstream you can get them, the better. You have to really think about the lived experience. We get some proposals that come across where it's like, Dr. Jones down the hall had some condition, and so they're going to be a patient partner. And that might or might not be relevant to your work. It's all about what are you going to get from the experience and the engagement as a researcher. You want to have access, you want to have a different perspective, so you want to make sure that you're getting perspective from someone who truly has the lived experience that you need, that will help inform your research. And that is the really important thing about the lived experience piece, right? There's a lot of work that needs to be done. You need to think about what the patient partner is interested in. I don't think that you'd get involved in a project that you weren't interested in. Mm-hmm. So it's really important to think about that. You might need to orient your patient to the research, your partner. You would need to understand what their skills are and their familiarity are. A patient partner comes into the research team without necessarily knowing what research is, and they may not know the difference between research or quality improvement or even just getting healthcare. And so people come into this work for a lot of different reasons, and so it does take time to build the relationship and to understand what their needs and skills are, and then for you to help them understand what you want as a researcher to get out of the engagement. So it's not a simple process, so you need to consider this, but it's definitely doable and worthwhile. Number of patient partners, that's also important. If you have just one patient partner in your research team, remember, if they are patients actively living with a particular condition, they might not be able to attend all your meetings. It's going to be difficult for them. There are lots of barriers to consider, lots of things to consider about it. You need to communicate in plain language. Can't stress that enough. A lot of us researchers, we talk in acronyms. I mean, Bev's constantly calling me out on it when we're, talking away and we're using our acronyms, and she's like, okay, spell it out or explain it. So, of course, Bev, now you probably talk in acronyms better than I do.
I just make up my own.
You make up your own. Okay, good. And again, it's like the planning. Plan, plan, plan. Did you want to say anything else about the engagement considerations?
I think you hit it all on the head.
Okay. So there are some ethical and cultural considerations. Now, this could be a workshop of its own. So I'm not going to go into this very much in detail. BCH is doing one in June on cultural safety for working with Indigenous populations. So there's lots of different ways to cut this, and we have to think that it is all about considering your population of interest for your research. And if you're going to engage them as researchers, you have to meet them where they are. And if your study is in a particular community, a particular population, a particular racial group or cultural group, you need to have some understanding of those areas. A lot of researchers already do that work. If that's your population of interest, you are probably learning some of that. So it's all about taking that to a different level and asking your patient partner what's important to them. What are you going to need to understand about their cultural norms, about the way they do things? Because if you go in there and you're not doing things the way they expect, they will not respond well to you. So something to consider. You have to think about all of the barriers, and there are lots. I mean, physical ability, their cognitive ability to understand, emotional aspects. You're asking someone to come and join a research team on pediatric palliative care, then you have to be supportive of that person because that person has gone through quite a significant ordeal. Mm-hmm. So we have to be supportive of our partners. And then the question about compensation, which we'll talk a bit about afterwards. So what do you think?
Well, I think this a lot of times people are using the term diversity to kind of all encompass this, but diversity also means diversity of disease, right, of their disease process. So something just to kind of be aware of as well with these different considerations. So you have a disease process, a particular disease, but you may have patients that are responding and have different experiences within that as well around this. The most important thing, I think, is what Larry said, is you go to where your patients are, where your patient partners are, to help create sort of a safe space. And then your research and your outcomes will be far greater and far better in just considering that, instead of having us always have to come into a boardroom or a research facility or something, because that can traumatize, right? So I'm part of the Children's Hospice, and the research that I do there, the first few times I went back, obviously were incredibly traumatizing, right? So that team had to be conscious of that to allow me to be able to contribute in a meaningful way for the work that they're doing. So just something to be really conscious about, especially in certain populations, for sure.
Thanks. And the whole idea of diversity and representation and those sort of issues, they come up in a lot of research anyway, in terms of the sampling your population that you're interested in, or even if you're doing qualitative research, you're thinking about getting a wide variety of voices. But here, again, think about the depth of experience that you're getting, not necessarily the range of experience. It's all about sort of having meaningful engagement with a patient partner that can help you think about things in a different way. So a lot of issues, a lot of things to consider with this. There's no easy way through to negotiate some of these, but like I said, it's all doable. So we did talk a bit about compensation and reimbursement. So we have a policy at the support unit for compensating patient partners, and we came up with a schedule, and we're trying to recognize the time that people spend on this. And you're absolutely right. The question that was asked earlier, if you're asking a patient partner to leave their work during the day and come to an event like today in the middle of a Wednesday, that is a challenge. So you have to be ready to compensate them for that. I mean, most researchers, when they go to a research meeting, they're being paid for that. Although I did sit at one research team meeting where someone said, "We're not being paid to be here." And I said, "Aren't you all on salary?" "Oh yeah, we are being paid to be here." So it's not about the money though. It's about talking to the patient partner and finding out what are the barriers. If there are financial barriers, then you need to overcome those barriers. Maybe you need to be offering child support or senior parent support, or just parking. It could be anything.
And in the module that BC Support Unit has, it does go into this deeper. So we quite often, if we are partnering research, we become a line item. Okay, because we're not just, it's volunteering has changed in the role of patient partner. If I'm volunteering for a run or a fun run, I'm standing there handing out water. That's entirely different than helping to write a grant proposal or engage with a community.
And so we do have guidelines and some expertise in doing that at the support. Now back to the worksheets again. Another minute to write down some of the considerations that you're going to have to take into account. And that can include some of the challenges or barriers that you might experience in your own research. Okay, does anyone want to share some of the considerations that they're going to take into account for their own research? No one wants to volunteer for that? Oh, we have someone offsite.
Yeah,
How do we?
Put your mic on. Yeah.
It's on.
Go ahead.
Oh,
Perfect.
great.
So it just occurred to me that if we really want to change things, we need to listen to the patients who are complaining about that this therapy didn't work or this approach didn't work right.
Yeah, well, if you've ever been on Twitter for any medical conference, you'll see a lot of that going on. So yeah, I agree for sure. And I think some people have a lot to contribute. So finding out who those people are, I think, is really beneficial.
Great, thank you very much. All right, let's talk a bit about applying patient-oriented research. We're going to go back to our worksheets again. And I just going to, what was the example that we had before? It was the grant application, right?
Mm-hmm.
So just remind us what that was about.
So I'm doing one of several projects here at UBC, and so I've contributed from coming up with the question, sort of helping with the scope of the project, helping with the grant application, and that's kind of where the stage that we're at now. So I'm just wondering, if you can think of a research project yourself that you're doing or venturing into, and consider how you would apply patient-oriented research principles from just the brief overview we've done. Like, what does that look like for you in your particular initiative?
So we're just going to take a couple of minutes on this, and then we'll go back to.
Okay. Mm-hmm.
All right, let's go to number 4. Do you think of any project that you've done that you could apply patient-oriented research principles to? Does anyone have any project in mind that they would like to do this with? Or if you have a goal for doing that work?
Even at one of the other sites, if there's anybody there?
Yeah, absolutely. I'm sorry I
Sure.
haven't been asking the other sites before. I didn't realize it was so easy. You just have to press a button and speak. So press a button and
Larry's
speak.
a Luddite.
Technology is not my friend today.
Nobody.
So if you're, one of the comments we had from one of the sites was talking to your patients about complaints about the health care that they're receiving then. So is there anyone that's doing any work in that area, research in that area, that might benefit from a patient-oriented research approach? Anyone setting a goal for themselves for doing this work? Someone must be. Oh, we do have someone.
Well, I was going to say, some of us are not going to be because we're all here.
Yeah.
We're not care about some of that. But, yes, the one project that was also, as you know, we've already recruited one. Yeah, so good. Another project I've done, this style of research, but not through BC support unit. I've definitely had some challenges in terms of retention, people getting out of their jobs away and that kind of thing. But it's also a very rewarding, to me, it's essential. Yeah.
Great, thank you. And someone else had something they want to say too?
I was just wondering, so we're not clinicians in the lab that I'm working with, but we have been contacted by patients and have been working with them to set research goals very much along like this, but they're in the U.S. So I'm just wondering if there's any, like, you know, if there's any way to contact BC support to find cohorts in Canada or patient partners in Canada.
Yeah, there definitely are some limitations as to, in some cases, like with rare diseases, when you have such a small population. We do have Data Scout that helps through Population Data BC that helps people access some of that information. But what the best approach to this has always been to find clinicians in your area, yeah, and that hasn't worked. Well, you can always contact us and we'll see if we can work through it. It's not necessarily easy to do that, and sometimes it's finding, instead of patients, family members or other interested community members, and doing a more public approach. So same if you're doing some public health research like vaccination or health promotion.
It's kind of like the SMA families, you know, as children, if they had SMA1, were going to pass away before the age of 18 months. And those families came together as a collective and created partnerships with researchers actually in the U.S. So it might be a resource for your particular group to talk to them on how they did it. And now we have a treatment for SMA that's now entering into community because of this collective that went that route. So it might be a model that might also be wrapped around that, but I'm sure BC Support can put you in contact with those sorts of models that are similar.
Absolutely, thanks, Beth. And anyone else have any comments or questions 4 or 5 from the worksheet? Anyone from the sites? Seems not such a Luddite after all. I never could do that. Okay. So I'm just going to spend the next couple of minutes talking a bit. This is actually a good segue into what the support unit does. We have a lot of different tools and supports available, a lot of resources. We can help with things like patient engagement planning. We have templates and tools and workbooks, lots of things that we've used. We've tried a number of these tools ourselves. So at the support unit, I can do actually consultations with research teams. So I sat down with research teams and their patient partners to talk a bit about, you know, what is this all about? And sometimes it's just about having that conversation of, why am I here? What are you expecting from me? How can I help? You know, and that's from both the researcher and the patient partner, sort of trying to figure out what their roles are in this. And there's lots of things to consider about, like how much you want them to be involved, what stage of the research you're at, what kind of role are they going to play, all that sort of thing. We can actually help work through some of those things. We also do training, as I mentioned before. We do have access to REDCap for patient-oriented research projects. We have a knowledge translation lead that would be here today, except she's in a conference. We have lots of partners who help with research method support from C2E2 or CHAOS. We have consultations and pragmatic clinical trials. There's lots of things. I encourage you to go and look at our website. Electronic communities of practice are new. They're really helpful to have a platform for you to actually communicate and do your work. You can access a lot of these services by contacting us at the support units through our inquiry form. If you go to our website, that little red circle there is where you'll find the inquiry form. And I encourage you to go and explore our resources, because we do have a lot of resources there that you can access. If you want to access the ECOP, then you have to become a member first. It's free, of course. You create a membership on our site. It's a private platform. When you become a member, you can join a particular ECOP, and only people who join that ECOP or are invited to join can see what's ever on there. If you need any help with that, we have Belinda here, who I forgot to introduce earlier. Belinda in the corner there is our project manager at the support unit, and project coordinator, and she is she's great with ECOP. So it's technology, and she's young. So it's electronic communities of practice. It's like a wiki page or a blog that allows you to communicate. So it replaces email. It's a place to store documents, not data, because it's not meant to store data. RedCap would be a better place to store data. But it's a place for you to communicate. So the good thing about this is it's kind of like the UBC 2.0 platform. What's that? They're a document sharing platform, but it's accessible to anybody. It doesn't have any firewalls. It's private. It's secure. It's in Canada. But it's just a place where patients, researchers, clinicians can all talk and communicate and post information.
So for your group, instead of having a Facebook page, then they can have this electronic community of practice where you can upload information, have dialogue.
Let's talk about that afterwards. Belinda is the person you want to talk to as well.
It's a big questionnaire.
Now we're actually, since we're answering questions, we're going to spend a few minutes talking about just answering some questions if you have any. And then we also have this evaluation survey that I want to make sure I leave time before that. So what time do we have now? So are there any questions? We'll do a minute of questions, and then we'll spend the rest of the time doing our evaluation. Any other burning questions? How about in the sites? No? Great. Well, oh, sorry, I didn't see you. Can you turn your mic on?
Sorry, I was just wondering how patient-oriented research applies in more acute and lethal conditions, because my thoughts are if a disease is very life-threatening, the patient's going to say, well, can you let me live? Mm-hmm. Essentially, that's going to be their burning question. Whereas personally, I work on HIV, so there's a lot more, well, sorry, Len works on HIV, I'm in her lab. There's a lot more nuances, a lot more things to look into, but in a very acute lethal condition, I could see the life being the main thing that they want, and that's also the thing that research wants. So I'm wondering how we can go beyond that.
Absolutely, that is a really good question, because when a person is in the midst of acute treatment or whatever is happening in their life, their crisis, then they might not be ready or willing to do this. They're going to be focused on their own health. So one of the things that we look for are people who have recovered or are in recovery, or family members. I think that's probably for some conditions, pancreatic cancer for one. It's really, you don't have a long-term survival there. So you need to think about alternative ways of accessing that. And usually it's caregivers and family members.
Mm-hmm. Yeah, I'd agree. We actually did a workshop, and it was some big neuro trauma surgeon that was there, and that was his question too. He has patients that are in trauma, right, and they're neurologically, impaired. So he had a similar question, and I think it's just sitting down and just looking at that cycle within that patient's experience and seeing where in there you can have a conversation or decide from the patient's perspective too. I think rather than look at it so short, really look at that patient journey and who's impacted in that patient journey along the way, whether it be a nurse, a parent, a loved one, somebody is impacted in that disease process, whatever that journey happens to be. So think of it that way versus, the immediacy of what their disease process entails.
And today is an overview. It's meant to be a sampler of different things. There's lots of details and lots of resources that can help you navigate some of the different challenges that every research project is going to have unique to them. So I really encourage you to access the unit's resources for that. I'm curious, has anyone, is this turned out to be the workshop that you were expecting? Has anyone found that they were lacking something, that they wanted to hear something else? So I'd really like to know if that was the case, and certainly you could put that in your comments if you don't want to say it out.
We have one question from Children's here.
Sure.
Hi. So, sorry to interrupt your train of thought. One of the questions I had, how do I do this?
Yeah, no, you're
okay. One of the questions that I had was just navigating the complex nature of everybody involved in your research team. So one of the things that has come up for us as we start this journey is just we have patients that have lived experience, but they also have other expertise and skills. So we've got like the healthcare lived experience, and then other experience possibly in their own their jobs that they're doing and things like that. And is there anything that is there any concern, or is there anything that we need to keep in mind in terms of do people need to separate their patient lived experience from their professional lived experience?
Yeah.
I think that's a really big debate. I'm going back to Twitter because we're a lot of us on social media. That was actually a debate today that was going on as a patient partner, do we try to engage patient partners with a particular skill set that we're looking for? So I'm here, I teach the POUR curriculum with Larry in the Lower Mainland. I have facilitated and co-facilitate before, so it was a natural fit for me to get involved. I think you'll find that patient partners will naturally fit into areas that you're inviting them into based on their comfort level as well. So I think it naturally occurs anyways, but I know it's a bit of a debate because I would imagine that you don't want to take advantage as well, right, of their skill set. But to leverage it, I think most patient partners are okay with that. But again, it's a conversation to have with that patient partner. But Larry,
yeah, it is a really good question. This one research team I was at with a patient partner was a statistician, so wanted to do the stats for the project. But that's not what they were there for. That's not why you wanted them. We wanted them to be there to give their lived experience. It always goes back to that lived experience. How is that going to shape and give you insight that you don't have? So if you're not getting that from your patient partner, then you need to ask more. Not what was their lived experience, but how does your lived experience, how does your perceptions about in your experiences, how does that change our perceptions? How does that influence the research? So always going back to the lived experience is a really handy way of doing
for sure.
That. Yeah. But thank you. Thanks. So we've run out of time now. I really, 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 really want you all to fill out your evaluation forms. I'm sorry, did you have one more question? No? Okay, sorry. I'd really like you to fill out your evaluation forms to let us know what we've done right and what we've done wrong and how we can improve, because we're always looking to improve this. I'd like to thank everybody for being here today and all the sites. Thank you for Gabriel for coming out and helping us in our moments of need there with the technology. So I should know that every time I touch technology, it's going to fail. So, but anyway, I'm really glad to have you all here, and thank you very much. Thank you, Heather.
Thank you.